Vaishali ji wants to make a very quick announcement and then we'll get started with the sessions.
This is my just suggestion. I don't know how far it will appeal to everybody, but I would say that since we are from different backgrounds and have come here for one common cause, let us form a WhatsApp group so that if we want to do any collaborative projects, so it will be easy for us to communicate and get this one. I'm circulating my diary so that it will be easy. You can give your email IDs and contact numbers. Strictly one rule we will follow: no forwards, no good morning, no good nights, no anniversary, birthday wishes. Only intellectual sharing. That's all.
Being respectful.
Yeah.
This is practice at IHMR. After the closing of the program, we make WhatsApp group and we link with each other.
Okay, thank you. That's absolutely okay then. No problem. Okay, thank you, ma'am.
Soumya, we'll be able to get the contents also because we can use that for training also in fact.
Yes, we are. Definitely. I think that's the point that PTG also made. But the training has to be standardized. That's what we will circulate. So whoever wants to use this as training material to in the future can do that. Which is going back to the group. Just be respectful. We may not agree with everyone. Okay, so we are back. Okay, I thought it was a very good discussion that we generated in the last session. So we have about roughly an hour. So we won't rush through things, but hopefully you'll have time to reflect and do things as well. So the next one is another exercise we are going to do, which we call it the hearing voices exercise. So as you all know, people hear voices in different contexts and can impact on them in different ways. So what we are going to do is groups of 3. 3 लोगों के ग्रुप्स बना लीजिए. आपको एक स्क्रिप्ट दी जाएगी. इनमें से एक पर्सन को वॉइस बनना है, वो एडिशनल वॉइस बनना है, और 2 लोगों को बातें करना है. तो आप किसी एक को चूज कर लीजिए जो बात कर रहे होते हैं. तो उसके कान में you make it into a little cone and उसके कान में continuously बात करना है. तो इंग्लिश में हमारा स्क्रिप्ट है, तो आप हमारा इंग्लिश स्क्रिप्ट you can use that. But for those who can't do English, हिंदी में जो बात करना चाहे आप एक नॉइज बना सकते हैं या लो वॉइस में आवाज कर सकते हैं. आप समझे मैं क्या बोल रही थी? तो 3 लोग बात करेंगे, 3 लोग एक ग्रुप में रहेंगे, 2 लोग आपस में बात करते रहेंगे और तीसरा कान में किसी एक के कान में कंटिन्यूसली बात करना है. 2 मिनट बात करना है सिर्फ, जो भी बात करना है. और उसके बाद आपको ये स्मॉल ग्रुप में डिस्कस करना है कि जब ये आवाज आपके कान में बज रही थी तो आपको कैसा लगा बात करते, कम्युनिकेशन कैसा लगा, और दूसरा जो ये देख रहा है कि आवाज किसी को बात कर रहा है, आप उसको कैसा लगा. These are the 2 things. So we want a hearer's perspective and somebody who's not hearing the voice but you're seeing somebody being, who's going through the distraction. What is that like? Did that make sense to everybody? Good. So groups of 3, please. Try not to be with your friends. So what we'll do is at the end of 3 minutes, within the group you generate a discussion about what it was like to have the voice in your ear and the others. You can do that.
It's your script to so this is the guy. So that's what all the time. Doctor, why is it
अगर ये बोलना नहीं सकते तो कुछ भी और आपको जो बात करना है आज क्या किया ओके जो भी आवाज speak directly into the air. The idea is
just for the sake of
Hopefully you've all done the exercise. So I hope you're all talking about, reflecting on what it was like to be the voice hearer and the person not hearing the voice. A couple of minutes more within your books.
He's actually saying I actually now I understand how strong earlier his perspective से आपको देखा था मुझे लगा था कि आपकी कम्युनिटी
Thank you for participating in this exercise. I hope you've all had a feel of what it might be like when you're hearing the voice. So just for people who are not aware, hearing voices is an experience that a lot of people with psychosis experience. There is this portion of general population also who may hear voices depending on various circumstances. So I think what we were trying to emphasize with this exercise is when you're communicating with somebody, जब आप किसी से बात कर रहे होते हैं, तो अगर वो distracted है because of voices or something, their attitude may be very different. वो बहुत गुस्से में हो सकते हैं, they दुखी हो सकते हैं, या completely disengaged भी हो सकते हैं. They may not talk at all. So it is being mindful of these things. So because people who were not hearing the voice but were observing somebody hearing the voice, must be getting irritated. आप कुछ बात करने की try कर रहे हैं, आप एक सवाल पूछ रहे हैं, ये क्या बंदा मेरे, he's not responding to me, she's not telling me what I want to hear. So that will happen. So it is being mindful that somebody hearing voices may not always tell you, I'm hearing कान में कुछ बज रही है. They may not tell you that. लेकिन they may show signs like irritability, or they may be distracted, they may be looking here, there and everywhere. So just be mindful of that. So that was the point of the exercise today. Okay? So what we will do next is, I'll just hand over to Steve and he'll tell you what we are going to do. It is we will be looking at interview techniques. So
So moving us on from the hearing voices exercise, we're going to look at interview techniques, then an exercise on reflection and reflective statements. So we're going to look at managing our reactions, eliciting further information from open questions, reflecting and summarising. Some key skills, some core skills. We're assessing the presenting problem, and we're looking at its duration and impact upon the person and its presenting features. So in this session we're going to explore in a little more depth our personal attitudes or feelings about mental illness. It's important to remember that this can also trigger some feelings and emotions from within ourselves. So as facilitators, if any time of the day you become a bit distressed, a bit worried, something's of a concern to you about this process, please just raise your hand or flag us over or have a quiet word, because we have to look after ourselves within any of these exercises. We also want to develop strategies to manage ourselves in order to provide the most empathic approach to our interviewees. And I think empathy is something we strive for, to get that understanding, to see it from the person's perspective. You will see it maybe starting off as sympathy and then moving to a deeper understanding of that person's world, how they experience it, their emotions, to empathise with them and their life. So we've talked about triggers, we've talked about uncomfortable feelings, and we've talked about how the listener may also go through this. Now, a colleague of mine does work on post-traumatic stress disorder, but he does it with vicariously when the carer is actually having more symptoms and more trauma than the person who's experienced it, because they're reliving it, they're going through it. So it's important to look at the whole unit when we're doing this, and that's what we do within our training. We look at everybody's experience. So this might be because clients report behaviour that clashes with personal values, and it can make us feel a bit judgmental. One thing I found with educating nurses in India, for me as an outside trainer, it was important to understand the culture, and we've mentioned about understanding the context this morning. I think it would be wrong for somebody from the UK to come over into India and say, this is how we do it in the UK, this is how you should do it in India. It should be the exact opposite of that. People who come and train should have an appreciation of that culture, but also should do it jointly with people from that culture. So I think that's how we lead to more sustainability. What I've also found from training is that we then see nursing staff from India coming over to the UK and training English nursing staff and saying, this is our experience in India. And then we find we have lots of things in common. They're just different degrees of severity. So we have staff shortages, but not as much as 2 nurses looking after 30 patients. We have cultural differences. For example, in suicide, we have a range of substances that are abused in the UK. But if you talk about pesticide ingestion or poison ingestion in the UK, there won't be many people who have experienced that. So both cultures have to learn from each other and reciprocate. You know, joint experiences is key to this. Also, there is a tendency in the UK for people to focus on suicide and what we call deliberate self-harm. And we do that, but we then neglect self-care and neglect, which can be equally as traumatic and worrying as a risk. So what I'd like to do is get into the exercise first of all, and learn about our symptoms, our triggers, our personal values, our judgments, distressing triggers, memories, loss, grief and guilt. And sometimes levels of neglect and self-harm is unsettling, and it's difficult to talk about. I started off talking about suicide and deliberate self-harm when I started my career in psychiatry. Very soon after that, I was then talking about violence and homicide and serious violence. I found that quite difficult because I was used to asking questions about suicide. What's your ideas? What's your plans? What's your intent? And going through and exploring them with persons, clients, participants, family members. But then when you start asking patients questions like that, or persons in your cases, you then have to be prepared for somebody who says, yes, I want to kill my partner. And it's the same with GM HAT and tools like this. You have to be prepared for, it raises questions, it raises issues, but what if the person then comes back to you and tells you something, I wasn't expecting that. So you've got to be prepared for both sets of replies when you ask them. I also then worked with perpetrators of sexual abuse, and I was working on risk limitation with perpetrators of sexual abuse who were in a secure environment. And the angle I came at it from was, this is protecting future children from abuse by working with risk in the individual and reducing that risk. So you have to be very self-aware but conscious of a positive and a negative reply. So there's different depths you can go to in your interviews. But I hope you get my message from, I was comfortable talking about suicide. First of all, when I started talking about homicide and beliefs of violence, it was uncomfortable. But then I had good supervision, I had a good mentor. And for me, I had clinical supervision every month, every 4 weeks. I had a very good clinical supervisor. So I'd like to emphasize, if you're listening to trauma and you're going through GM HAT and you hear things, it's important to have somebody that you can reflect with, have clinical supervision with. Is the concept clinical supervision, what might you call it in an Indian context? In UK we call it clinical supervision. What might you call it here? That's my first question. Do you have supervision of your practice? Some do. Let's have a show of hands. Let's be bold and say, who has clinical supervision regular and would never practice without it in the room? Because some people think that clinical supervision is a way of appraising your practice. Somehow you've done something wrong and clinical supervision tells you how to do it. Now for me, as a mental health professional in the UK, in clinical practice, I would never practice without it. It's not about discussing every patient, it's about discussing certain points of somebody's care that you're not comfortable with. I don't want to pick on the three people who were brave enough to raise their hands, but what benefits did you find clinical supervision gave to you as a group of three of you in here?
It's common sense that two brains work better than one brain. Not better than one person.
So some people see things that you might not.
So I was a professor in my institute, but I have another professor. Both are professors. But it's very important some difficult cases like model personality, substance, comorbid. Good to discuss. I mean, you're not losing out anything at the end of the day.
So it's a concept I'm introducing and I'm putting it out your way to explore it as a useful thing.
It adds to collective wisdom. Collectively you can get the solutions of many things.
For me it was also, I agree, but for me it was about identifying blind spots, things that I didn't see, and things that I was maybe uncomfortable with that I needed to learn more about. And you do it in different forums, you may do it informally.
So it also not only enhances in skill building, there's one more thing is that it also helps in processing what the therapist was experiencing as well. Because when we're talking about, recognizing as therapists that we are human beings and we come with our own biases, we come, and when you're listening to trauma for a long period of time, it does impact you. So then even the supervision actually allows you to process the self of the therapist and not only enhance your skill set, learn different scenarios, become better in such cases like critical cases like suicide. And if you have a patient in front of you who has psychosis, as a new therapist, you may not know how to handle that.
So are you telling me that you're human, you have emotions and feelings, and sometimes they get in the way of your job or might affect your job or influence it?
Yes, and recognizing
But
that.
some people might say that's not professional, and you would say to them?
I would say to that is not possible because we are all human beings and we are bound to, it's a checking system and we are actually acknowledging it beforehand and making it a part of a professional development.
So are you telling me as a professional you should reflect on your practice and think ahead over what's just gone on, but how that might be important in the future?
Yes.
That's all I can. I'll do a gesture rather than a comment to it. Anything else before we move on?
It also helps in unloading also, sir. Like if you are getting emotionally carried away with something and you are going only in one direction with discussion with your senior or with your colleague, it helps you to unload and go into the proper direction so that you can get a better solution.
So reflection is helpful,
Yes.
it's constructive,
Yes.
it's professional, developmental, but it's something in the UK we don't do as much as we should. Because we're so busy, and you'll tell me you don't know about being busy in the UK, but we're so busy, we have high caseloads, and our reflection time and our clinical supervision time are usually the things that suffer as a consequence.
And there is also one thing that as you practice and grow senior, with years of practice, you think that you know everything.
Oh, don't you?
That attitude is also which is many a times maybe a wrong thing, like we don't know certain things, and so it also adds to that.
I just want to add to her point. There is burnt out that we have not addressed. Burnout happens in our profession as well, and that allows, the supervision allows to address that issue, because over a period of time you are handling the same cases, you can become disconnected, and that reflects in your practice as well. So burnout is something that is really happens, we don't talk about it.
How do we avoid burnout as professionals then, or as people who care?
So one of the things is that when we are talking about building support systems, supervision allows you the scope not only for unloading, okay, and quickly looking at what, when the changes are happening. When we are talking about looking at the changes even in our clients or patients, we have to look at ourselves as well.
Now I agree, and I'm fascinated by the term that you use, unloading. That fascinates me, because as a supervisor, so as well as me having supervision, I give supervision. And if somebody was to come into a session and they unloaded and they went out the session feeling a lot better and, oh, I feel better after that. But I'd feel as a supervisor, oh, I've had an hour of, I feel burdened and unloaded on that. So I would give that back to the person I was supervising, the supervisee, and say, hang on a minute, let's just look at that again and how that made you feel. So you have to be aware that the term for me in my culture, unloading, is you dump and you give it to somebody else.
It's not like that, sir. Actually, when we talk about unloading, it is preparing. When I have unloaded, shared something with you, that means that you are more mature enough to handle such things because you are senior to me, you are supervising me. So I expect that you teach me or demonstrate to me through your behavior that yes, how to do unloading, how to not get carried away.
On a similar level to what we were talking about patient relations.
So when I am unloading with you, it doesn't mean that I am loading you. It means that I am learning from you how to unload things, how not to get carried away.
And I'm learning from you by you disclosing that.
Yes.
So it's
so
that.
It is the mutual trust that we have,
Yes.
and mutual professional relationships, that I need your help. At the same time, you are demonstrating to me through your behavior that how I can deal with or tackle with these type of problems.
Yeah. And that might take some time to develop.
Yes.
So, but you're seeing that from profession to profession,
Yes.
but you're also seeing it in your patient
Yes.
therapist, patient-doctor relationship.
Yes, it needs. It needs.
So that's important to acknowledge.
Yes.
And before we do the exercise, you can see how it can relate to your professional role, in your peer-to-peer role, and you're getting a chance to critique yourself. And that was very honest when you said, I'm at the top of my game, I'm experienced, I've done 20, I'm guessing, I'm saying I've done 30 years, but you've done some years experience, and you think, but we all need to keep being developed.
Yes. Yes. We should be lifelong learners.
Oh.
If we are that, then maybe we are on the grounds and we will be more, open to the things that are coming to us. That is very important.
Absolutely. Absolutely. So, reflecting and summarising, I've told you that these are beneficial, these are positive, these are protective to you as health staff, but they're also developmental for patients because they keep you at the top of your professional game. I sound like I should be playing for Liverpool or something like that, but they do keep you alert. So as well as being protective, they develop you and keep you alert clinically. So reflecting and summarising can be very effective in helping a client experience the listener as having heard them. When I talk about this in presentations, I immediately go back to my home environment, and you practice it all day, but does it go on at home? I'm not asking for feedback. I'm saying, do you listen at home? Do you hear, your partner communicating? Do you listen to your children? Well, you've done it for 8 hours in a day, and it can be exhausting sometimes to do it. So practice it, make it a way of being. Reflect and summarising are excellent ways to have something to say when what you want to say may be judgmental or attempt to fix the client. Sometimes it might not be about fixing, it might not be about curing, it might be about reducing, coping, managing. So that's important when we talk about new relationships. When you build up trust, there's honesty in it, and reflection helps with understanding that honesty and building that trust. For example, somebody may tell you that they are feeling suicidal. It's not appropriate to tell them they shouldn't feel that way. Nor should you tell them that everything will be all right, though your impulse may be to do so. But by using and reflecting and summarising, it shows you are attentive. it's not just about sitting in the room, it's about being present in the room, being there mentally. Because anybody can sit there, but show that you're attending to that person. That might not be speaking sometimes. So we're summarising, it's given a brief synopsis, an overview of what the person has said without interruption. I'll get home, and my children, even though they've now left home, but when I got home, would be straight there and say, "Oh Dad, I was in school today," and this, and then the other one would talk. And then my wife would come in, and there'd be 3 people communicating at the same time. And you think, I don't know what to listen, I don't know how to respond first, just give me some time. And that's important when you're communicating as well. Time to hear the message. So reflecting is about picking up the feelings and emotions attached to the statement and helping the client name them. Summarising is a statement. I called my sister to please come and help me last night because I just couldn't cope. And she told me she was just too busy and that I would just have to learn to take responsibility. Sounds very sisterly. So you have reached out to your sister for help, she's refused to help you. It's neutral in tone and it's recounting what has been said. Can you see how that statement sounds neutral? It gives an honest portrayal of the statement above. So you have reached out to your sister for help, she's refused to help you. You've captured it, you've reduced it. But one of my dislikes in therapy is that it can become artificial. Paraphrasing and reflecting are not just firing back what the person said. You've took it in, you've interpreted it, and you've given something back based upon your interpretation. So a statement like, I guess you feel angry about that. Now maybe that's because I'm a health professional, but I would see through that. I think it's important to be natural. I think it's important to show understanding and compassion. But don't be artificial and mechanical. Be yourself. Give that humanness over to you. The outcome is summarising. The response is quite neutral or natural, but will encourage the speaker to continue to elaborate. So you've shown some understanding, you've given something, and then they might want to tell you a bit more about that because it shows you're there, you're attentive, you're present. Reflecting. I called my sister to please come and help me last night because I just couldn't cope and she told me she was too busy, that I would just have to learn to take responsibility. It sounds as though you may be feeling unsupported by your sister, but perhaps she doesn't understand the stress you're under. A good level of reflective statement. You've taken it in, you've got the meaning, and you're attaching the emotion to it. A reflective response will encourage a speaker to continue, but with the acknowledgement of the emotional content, could encourage speakers to further explore these feelings. How do you find my Liverpool accent in here? Am I managing to mask it, to hide it? I usually speak a lot quicker. I'm slowing it down. When I get excited, I speak a lot quicker. My tone varies. I try to vary my tone when I'm teaching because my natural voice is quite flat, quite monotone, quite uninteresting. So if I vary my tone, my eye contact, my rate, my gestures, my facial expression, I hope it's a bit more engaging. So think about your own tones, facial expressions, the ways you communicate. I bet if by 1 o'clock you'll all be asleep, but I'm trying to, I engage you, I walk round, I look at you, hopefully for appropriate periods of time, and don't stare. So these are all techniques you use when you're communicating, but you can also use them when you're teaching. Those of you who teach in the room, and I know who you are, if you've got students who are texting or disinterested, what do you do to them? You are.
Tell them to get out of the class.
So go for innovative
Confiscate
ideas
the phone.
to improve the pedagogy
Yeah.
of teaching in the class.
I hope that applies all the time, but it's a challenge, isn't it, to do it?
You try to engage them, you talk to them, ask them if they are understanding.
Yeah.
You smile at them in a
Yeah.
softer way.
So, by the way, if I smile at you or I walk up to you, it doesn't mean that you're sleeping or things like that. But these are strategies that you use. Yeah. Yeah. You do.
And the experiential exercises can actually hold attention. But if it is just a lecture, then it doesn't hold attention.
It's quite difficult for me talking to a wide range of professions in here with probably more experience than what I have in these areas. So you have to accommodate the audience that you're with. That's important.
It also depends on the topic that we are teaching. If it's a very disinteresting topic, like say, sometimes I teach some biochemistry classes I take, and it is really very boring for them, and the subject is highly volatile. So what I do is I make the students stand up, clap 3 times, so that all are aware. And then I ask some, when they sit down, I ask some questions like what we have learned just now. Something related to more of physiology related biochemistry. And then maybe they are more attentive in that way. I do that. So we have to be tactful when we are teaching.
Absolutely. And somebody mentioned this morning that they find mobile phones a distraction when they're doing it, and people who engage. I see people walking down the street on their mobile all the time and not looking at where they're going or not seeing the wonders of what's around them.
Smartphone, export some question, and problem in India is that not all here, you are anonymous, so they don't know what is going on around. It has been partially effective, but you use tactfully. That has been
on your smartphone, but it's not okay any other time. Maybe.
One observation I have, that in today's changing global environment, children are generally using the smartphone. In our times, we were used to study for a long time at a stretch. Now it is found that students, they need breaks for studying. Because the interest of the students have declined in study in the recent times, and it is for all over the world.
Do your thoughts ever get mixed up? Do you find that you're able to think clearly?
They get mixed up because I think that.
There's that one, yeah. Okay. So we've got an activity to give out to you in a few minutes. We just thought we'd play this short video. It's about 4 minutes long, about somebody using a GMAT assessment tool, and some of the responses are ones that can relate actually to a previous exercise around hearing voices. So somebody talking about some experiences they have around hearing voices, seeing things that other people don't see. And sometimes those are really quite challenging things to respond to. So in this video, you see the assessor gives some kind of immediate spontaneous responses to, well, how does he respond to somebody saying that he's responding to hearing voices, seeing things that other people don't see, in a way that perhaps tries to capture something about what that feels like. So we were doing this hearing voices exercise. Well, what might it feel like to do that? And in this assessment, he tries to capture just in a snippet. I mean, really, it's not sort of over-elaborate on that, but just in a snippet, which sometimes perhaps can be quite a helpful kind of tool to have in the bag about, okay, if I'm in a situation which I feel like I'm not quite sure what to say, maybe there's some other thoughts about how you can respond to some maybe more challenging situation.
Do your thoughts ever get mixed up? Do you find that you're able to think clearly?
They get mixed up because I think that they're able to take the thoughts out of my head through the television, and that's why my mind goes blank.
Right. So you don't feel in control of your own thoughts? Sounds like it must be quite obsessing with that.
Yeah, it is.
I think you mentioned this to me, but do you believe that people talk about you on the TV?
Oh yeah, definitely. I think they send me messages. I think it's the neighbours, but I think it's something to do with this organisation as well. And they send me messages through things like EastEnders and things like that. There'll be like things in the pub that I can see that they're trying to tell me about.
Right. So if watching TV and that's happening, how does it make you feel?
Really scared.
Okay. You mentioned that you hear people next door talking about you. When you have friends around, do they hear the same thing, or do you feel you hear things that other people don't?
I don't have any friends around.
And when you hear the voices next door, how many are there?
There's sometimes just one, and then sometimes there's 2 or 3 of them.
Right. And that must be quite distressing if there's 3 voices.
Yeah.
Do you ever see things that other people might not see?
Well, yeah, when the telly was off the other night, there was sort of like a face in it, and it looked like a black hand over my face. But the telly wasn't on.
Right. So you saw a face on the TV?
Yeah. It put a black hand over my face.
What do you mean?
It was like a shadow.
And were you able to manage that, or was it quite upsetting?
No, I had to run out the room.
Okay. So when people are going through a time when it's very stressful, it's not usual to lose track of time. And I was just wondering whether you knew what the date was today.
Moves into a slightly different part of the assessment there, but I suppose there's sort of strengths and weaknesses in anybody's assessment. But one of the things perhaps that the person who conducts the assessment hones in on is what's the emotional response of that. So trying to make a kind of empathetic link about what might have been some of the emotional experience of hearing voices or seeing something, whether it was distressing or whether it's upsetting. And that really perhaps at times is a way, there are lots of different elements that can be helpful about that. One is, I think, for us, about how do we manage things that are quite difficult. But the other one is about perhaps people feeling that even things that are difficult to talk about can be acknowledged and can be experienced at a way that feels quite personal, quite kind of connected. We just want you to take a few minutes really just to think about, well, what are the sorts of things that we can say that tune into somebody's emotional content of what people are saying, rather than just our immediate reactions to some things that might be quite uncomfortable. So we have a short exercise of some examples of situations that you might find quite difficult, and just in the groups that you're in now really, just to take a couple of minutes to note down some statements that you might think would be appropriate to sort of tune into some of the emotional content. Should be enough for one inch. All right, okay. I think we're going to need maybe just a couple on each table. That's good. Okay. Okay, if you just take another 2 minutes, and then we'll just go around and perhaps each group give an example. Strip ourselves out of our own judgment. How we navigate it. But, like you say, it's how do you manage that? And how do you manage that? One game. So you sort of think, okay, need to allow myself to feel non-judgmental. Then actually suddenly something says something, and that's a bit of a shock. So how do you also understand reflective responses helps to build this rapport, helps to make somebody feel listeners to, but also sometimes a bit scared ourselves as well, and help us respond that helps us to manage sort of not even judgmental in a sense, but actually to some extent maybe feels like self-attack. Might be actually a little bit self-attack. wrap this session up. But having gone through the different examples, I wonder if some individuals, some tables, wanted to sort of volunteer just one of their responses that they felt they'd like to share. Where's the microphone? Okay. Yes? Anyone? Just one that you'd like to share.
He uses illegal drugs. There could be many people who use illegal drugs.
Okay, so you're kind of, in a way, normalising this response. Actually, the reality is there are lots of people who take illegal drugs, and this is one person.
Most of the drugs are illegal.
Most of the drugs That's true. Yeah. Yeah. That's great, isn't it? And I think that awareness of actually this is relatively common. Just because it's not illegal doesn't mean it's not relatively common.
Most of the drugs are useful, but misuse and abuse are illegal.
Okay. So another example? Another example, different statement?
Like a client tells you that he has been in prison for assault. The first thing which comes in mind will be what are the circumstances during the time, and like we say it's okay, you have you can overcome with it.
So yes, you thinking.
What is the next goal after releasing from the prison?
That's great, isn't it? So rather than thinking, oh, this is really frightening, this person's wrong, they're evil, they're bad, thinking, actually, what are the circumstances around that? Or you might be thinking, actually, how frightening to be that angry, to be overwhelmed by your own anger so much that you can't manage it. Any other? Yes, Scott?
This situation on a client revealing that she was a victim of incest or sexual abuse. I would start with saying, I'm really sorry that it happened to you. I know it would have been very traumatic. Would you like to talk about it?
It's a great invitation, isn't it? The gentleness of that to say, would you like to? Because you offer that invitation and that person can accept that invitation, or they can also accept the invitation not to. Yeah. Do we have one more?
The first one, the client tells you that he hears voices. I would say, although I don't hear any voices right now, I would like to hear what voices you are hearing and who is talking.
Yeah. So rather than dispute it and say, well, there aren't any voices, but you're not saying, okay, yes, that's true. So you're not disputing it, you're not really agreeing with it, but you're saying, actually, I'd like to know more. Can you share more? And that's great. And the invitation there, of course, also is to find out, well, what's the content of what people are saying? Because it's too, well, it's wrong, really, to think, oh, well, somebody's hearing voices, therefore this is a symptom of a psychosis. End of. But actually, what's the content of what's being said? What effect does that actually have on the individual? What type of voice might it be? Is it a man's voice or a woman's voice? Is it something we identify with the past? And then you start to understand their situation better. But of course, a lot of people wouldn't share that with a lot of people who are hearing voices wouldn't share that with other people because they'd be very worried that they'd be judged. That's a lovely way to perhaps draw this part to a close and go and have some lunch, and then we'll move on to the next part. Thank you very much. So the next session we're going to the PC lab. Next session is PC lab. Okay, so we'll aim for about 2. So we'll aim to have a slightly shorter lunch time to get back to move to the PC lab. 45 minutes? Pardon? 45 minutes. You think 45 minutes? So 40 minutes.